If you are preparing for birth and you're wanting to decrease your risk of tearing, let's go over 5 different strategies that you can incorporate now in your birth prep routine to help release tension within your pelvic floor musculature and decrease the likelihood of tearing. Welcome to the MamasteFit YouTube channel. My name is Gina. I'm a perinatal fitness trainer and birth doula, and I have supported hundreds of women in labor, helping them push their babies out, helping them decrease their risk of tearing. And I have personally given birth 4 times where I have not torn. And so let's talk about some strategies that you can include in your prenatal prep routine now to help decrease the likelihood of tearing. But as a disclaimer, if you do tear, there are sometimes factors outside of our control, such as baby's position. Maybe there's something else going on during your labor where the tear was going to be a little bit more likely, such as instrument-assisted delivery. So if you do tear, know that it is not your fault. It is okay. And our providers can do a really good job with our repairs, and pelvic floor physical therapy is a great option to help you feel strong within your pelvic floor again. The first strategy that you can incorporate into your prenatal routine to help decrease the likelihood of tearing is to practice pushing. So anytime that you are sitting on the toilet and you're going to have a bowel movement, we can practice our push breathing there. If we can exhale as we push or decrease the tension in our body and therefore our pelvic floor while we are pushing, this can help to decrease our risk of tearing. So when you're sitting on the toilet and we're having that bowel movement, we're going to start with our inhale to feel the perineum bulge and push down. So we feel an increase in pressure downward into our pelvic floor. And then we're going to exhale and continue to bear down as we have our bowel movement or as we are peeing. So you'll take your big inhale, feel that pressure down into the perineum, and then you'll exhale to continue to bear down and push. And our exhales are strong. It's not just letting air out. We're exhaling with force down into the pelvic floor to help push our poo out and then ideally help push our babies out. So you can practice this whenever you're having a bowel movement between now and when you give birth. We're going to inhale down to feel that increase in pressure, and then exhale, continue to bear down as we are pushing and as we are pooping out. And you can experiment between holding your breath and exhaling at the same time to see what feels more intuitive for you, and maybe a combination of both. But the key thing is to be able to relax within our body as we bear down with the push. The next 2 things that we can incorporate is internal pelvic floor massage and external pelvic floor massage. For external pelvic floor massage, you can use a lacrosse ball, a softball. This is a yoga tune-up ball to apply directly to the pelvic floor and massage externally. Or you can use a pelvic wand to insert internally to apply pressure to the pelvic floor to help release any trigger points. We'll go over some exercises that you can do in the next section to help stretch and release your pelvic floor, but sometimes some trigger point release can be incredibly beneficial to just helping you overcome some tension that you may be holding on to. With the myofascial release externally, you're going to take the ball and we're going to place it between your sits bone and your tailbone in this little pocket area right here. You'll then sit down on the ball and roll around and breathe into the ball to help release some tension within your pelvic floor. So you'll start by taking that ball, place it into that little pocket between your sits bone and your tailbone. I like to bend in both my feet to apply pressure into that area. And then you'll just kind of move forward and backwards until you find a point that feels a little bit more sticky. It feels a little bit more tender. And from there, we're going to think big inhale down into the pelvic floor. And then exhale, try to relax and sink into it a little bit more. And then maybe we do these little tiny circles. After we do about 10 breaths there, we can add in some extra movement. Maybe we drop the knee out and then bring it back in. Maybe we bring the foot out to drop the knee in. And so we can explore some internal rotation and release and some external rotation with that release, in addition to straightening and bending in the leg. After you finish up on one side, we can then move to that other side. Again, find that little pocket between your sits bone and your tailbone. We'll move around until we find a sticky point. Breathe into the ball. So big inhale. Exhale, release, sink a little bit more. Find our external rotation. our internal rotation, and then maybe straighten and bend in the leg. The next thing that we can do is some internal pelvic floor release. And we first want to find a comfortable position for this. So maybe we're seated on our bed or our couch. Maybe you're taking a bath or potentially even in the shower. This is the Intimate Rose pelvic wand, and it's bendable. So it's really nice because you can change the position of it to be the exact angle that you need. So with it, you're going to take the wand and we're going to insert it into the vagina. If you need to, you can apply lubricant to it as well. So you're going to insert it into the vagina, and the goal is to kind of hook it in to that pelvic floor. And so for me, usually the tension is towards the back part. So you might be kind of coming to the side of either side, or maybe a little bit to the front. With the pelvic floor, we can think about it like a clock. So we have noon to the front, 6 o'clock to the back. We're going to be applying pressure between 1 to 5 o'clock and 7 to 11 o'clock, avoiding directly to the front and directly to the back. So you'll insert that wand. You're going to find a sticky point. You'll then apply pressure there. Big inhale into the wand. And then exhale, release. And then we maybe apply a little bit more pressure. So this is an internal trigger point release. For me, this was incredibly beneficial because I was having more SI joint during my pregnancy, but this can be a really helpful way to release tension within your pelvic floor in a way that sometimes is hard to do with chest exercises and external release. You can also use your pelvic wand to do perineal massage, which is going to be pressure against the perineal area. So you'll essentially apply pressure directly on the opening of your vagina, and you're going to apply downward, outward pressure and hold there for a few seconds and just breathe into the space. Perineal massage has been shown to be helpful to decrease your risk of tearing if you are a first-time mom, but really what it's probably doing is introducing the sensation of crowning to you and that stretching sensation so that you can learn how to release and relax into it. So you apply that pressure and big breath in, and then exhale, just try to relax and to let go while feeling that stretching sensation. The next two things that we can incorporate to help decrease our risk of tearing is finding more internal hip and pelvic rotation. This is going to help to improve sacral mobility so that the sacrum can move more easily and out of the way for our baby, in addition to help bring the pelvic floor into a position that helps to stretch it and release it a little bit more efficiently as the baby is exiting the pelvis. The first thing is to find internal hip rotation. So knees will be in and then ankles will move out. It doesn't have to be super extreme. Just a little bit of internal rotation is totally fine. From there, you'll hold on to your ball and we're going to sink back to find a rounding in our back, trying to sit all the way down to the floor. But if you can't sit down to the floor, totally fine. You could sit down to like a yoga block or some pillows instead. And then we can come forward, big breath into our back, and then exhale, sit back, sink as deep as you can, and then just pay attention if one side feels a little bit harder to sit into than the other. Typically, the left hip is a little bit more restricted in internal rotation, just based on our normal postural tendencies. So that'll be something to apply to the next movement that we do. So we're going to find that internal rotation, rounding in the back, and then coming forward. The last exercise that we can do to help improve sacral mobility, to release tension within our pelvic floor, to ideally help to reduce the risk of tearing is going to be a hip shift. So we can use a yoga block, and we're going to place the left knee onto the yoga block and then shift our weight over so that almost 80 to 90% of our weight is in this elevated hip. From here, we can find a round in the back and just breathe into this back hip pocket. So big inhale, exhale, release. Big inhale, exhale, release. And now if you want in this position, you could use the pelvic wand to do internal release within your pelvic floor. Your partner or yourself can massage in this area with your hand. But in the hip shift, we're stretching this kind of back hip pocket area by the sacrum, which tends to be a little bit tighter on the left side. And then you can repeat it on the right side as well. Something else that we can do for the right side, specifically to help release that inner thigh and groin, is to bring both knees level to the floor, shift our weight over to the left, and you're going to feel more of a stretch here in this inner thigh growing area if we apply pressure down into that knee. So we'll do that same hip shifted position, and then from here, I'm going to think round in my back, And then maybe we arch in the back to feel a little bit more intensity in that inner groin. So shifting our weight over, finding an arch in the back to target the groin and inner thigh, and then exhale to round to feel it more in that left glute area. So we can use a combination of practicing pushing strategies by exhaling as we push and bear down on the toilet whenever we have a bowel movement, incorporating some myofascial release techniques to release tension within the pelvic floor, and then improving sacral and hip mobility with our internally rotated exercises and our hip shifted exercises to help release tension within the pelvic floor. All ideally, in theory, will help to decrease your risk of tearing because you'll better understand the strategies to push in addition to have a more relaxed pelvic floor. If you want more support throughout your pregnancy, check out our online prenatal fitness program that incorporates exercises to not only keep you strong and pain-free throughout pregnancy, but also birth preparation exercises to create space in each of your pelvic levels, release tension within your pelvic floor, and support your baby's position for birth. In addition to our prenatal fitness programs, we also have our childbirth education course that breaks down the science of birth. So you can understand how to push, what positions may be most optimal, different strategies, in addition to know what your options are for all of the phases of labor. What type of pushing interventions do you have, when you may or may not want those interventions, so that you can feel informed and empowered to make decisions during your birth to best suit you and your family's needs. You can check out all of our fitness programs and education courses on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And bundles are already 15% off, so you can add on an additional 10% off or 25% off on any of our bundles. If you want more videos like this to help educate you on how to move confidently throughout your pregnancy as you prepare for birth, be sure to subscribe to our YouTube channel. Every Tuesday, we release new movement workouts in addition to our podcast on Wednesdays.